Hello, my name is Samilla Santos. I am veterinarian with a master's degree in epidemiology and public health. It's a great honor to be here today to present this talk entitled Animal Protection Intersectionality, Building Care Networks Through Health Education. In this presentation, I will talk about how we created a team that works with health and environmental education, a project I helped design, lead, and put in practice together with a diverse group of professionals. I not just speak for the work we've done in Beijing, I also speak for many professionals and communities across Brazil who believe that care can transform lives by bringing people, animals, and public service together to improve life for everyone. But to understand what this means in practice and why interrogating people, animals, and public policy is so urgent, I'd like to begin with an image. This is not just one family. It represents thousands of families in Brazil. Families with people, animals live in poor areas, far from regular care and support. And when we talk about One Health, this is what we mean. People and animals live in the same place, face the same dangers, the same lack of services, and also the same strong bonds. To help you better understand where this experience was built, I invite you all to learn a little more about Brazil and Beijing City. To help you better understand where this experience was built, Brazil has more dogs and cats than children. A fact has been known since the year 2013. Today, more than 30 million animals are abandoned, and zoonotic sporticosis has arrived over 11,000 people. And there are even more serious warnings. 2/3 of Brazilian states are at medium or high risk of zoonotic outbreaks, a risk that grows alongside deforestation, poverty, and the lack of integrated. But we also see signs of hope. When carers arrive, it transforms. As we saw with dramatic drop and several hungry in just 1 year. Beijing has just over 411,000 inhabitants, and more than 148,000 live in poverty or extreme poverty. It's a city full of contrasts. One side, it's among the cities with the highest levels of violence in the state. But on the other side, it has seen an 86% drop in violent crimes over the past 7 years, the result of shared effort to make the local support network stronger. And animals live in the same space. In just 27% of households we visited, we found over 64,000 dogs and 15,000 cats. This shows a very high number of multi-species relationships. People and animals living together face the same dangers, sharing the same homes, and build strong emotional bonds. This place brings us many challenges, but also gives us inspiration. And it's here, in this reality, that we've been creating new ways to care. But many things have changed. In Minas Gerais, we state where Beijing is located. In the year 2017, the Public Prosecutor Office of Minas Gerais, through SEDA, created Prodevida, a program to help cities building their own local animal protection policies. Since then, over 320 cities have started actions, even small ones like offering spay and neuter services. In Beijing, this work began with the creation of the Animal Protection Department in the year 2018. And this year, we took an important step. The department, SEPA, became a subsecretariat, make animal care a permanent part of public policy. Today, SEPA offers several services: veterinary consultation, spaying, neutering, investigation of abuse case, history of loose herds and cattle, and shelter for animals, and much more. Having a public structure is essential. But once we started working, it became clear that this alone wasn't enough. What the shelter showed us was blood. Run-over animals, a direct result of unrestricted access to street. Hundreds of successive litters, a clear indication of the lack of sterilization, and perhaps the hardest part, no one even knew the city had an animal protection policy. And that made us realize we can't wait for people to come to the public policy must go to them. In that moment, we faced a key question. How can public policy reach a place where it simply doesn't exist? That's when we decided to act. There was no education team inside the Animal Protection Department, so we created a pilot project. We started with the schools. We met with the Municipal Department of Education, presented our plan, and built a strong partnership. We trained more than 600 teachers for early childhood and elementary schools. We talked about responsible pet care, zoonoses, and animal abuse. Then we went to the field. We visited 8 schools near our animal shelter. We listened to teachers, students, and families, and each school created its own project, using the language of the community, posters, players, and local dialogues. This result was so strong that we presented the data to city leaders and proved that this wasn't just a temporary project, but a real and lasting need. As a result, in April of the year 2024, the Health and Social Environmental Education Department was officially created within SEPA. The most direct path was to bring the population management policy into the community network of those territories. SEPA has just one unit, but Beijing has 16 CRAS centers, with stand for Social Assistance Reference Centers in Brazil. In Portuguese, they are called CRAS. And Beijing also has 40 primary health units. The network was already there. We just needed to join it. So we start with social assistance through the CRAS, which worked to prevent the breakdown of family and community bonds. That's where we saw something important. If the bond with the family is weak, the bond with the animal may also be fragile. We had to start where the pain was stronger or more vulnerable. The work grew fast, from one class to another and another. Soon it wasn't just social assistance. We start mapping local leaders, listen to the territory, and build a connection with those already care, even without a leader or formal role. We also mapped available services publicly, private, and mixed. We'd call, showed a visit and go in the person. And with a simple ask, is there space for this here? If they were open, we began gentle, a conversation with the manager, then a training with the staffs, finally actives with the people using that space. That's when we realized we weren't just making a contact list. We were building a real intersectoral network, connecting public policy, animal protection, community leaders, small business. Caring also means speaking in a simple way. We knew to policy had to reach everyone, with respect, clear language, and connection to local reality. With children, we used playful tools, coloring books, stories, theater. With older adults, we had conversation cycles with fabric, painting, and crafts, space for listening and care. With young people, we created the Idea Lab, a space where they propose solutions for problems in their own communities. In more vulnerable areas, we gave practical workshops and applied underlinked theory, which shows how violence against animals is often linked to violence against people. We also created a BioVet cycle, a project that talked about veterinary medicine, biology, and how to reach careers that works with animals. We start in Strolândia, a region with many challenges: poverty, social exclusion, and areas at the risk of flooding. To respond, we partnered with the Emergency Management Service to carry our action focused on disaster prevention. We did workshops with the community, mapped risk areas, and created simple materials to share important information through local social media. This guide explained how to protect families and animals during floods and talk about SEPA-free services like spaying and microchipping. The biggest lesson was clear. When we protect animals, we protect the people too. Clear water, emergency kits, evacuation plans, all of this matter for everyone in the household, adults, children, elders, and animals. If someone asked me, did it work? I'd answer with numbers. In the year 2023, only 7 out of 100 people who came to SEPA arrived through the formal public network. 2 years later, that number almost tripled. 20 out of 100 now come through that path. The CAS Social Assistance Centers, which were barely present, now bring more than 12% of all cases. Primary healthcare, which didn't even appear before, now represent more than 1 in every 5 appointments. This not is a small thing. It shows that managed dog and cat population has truly entered the daily routine of public service. When we look at the territory, the most symbolic change in this year happening in Central. It became the neighborhood with the highest number of appointments, but more important than the number was how people arrived. Residents of Citrolândia were 4 times more likely to reach us through the formal public network, like CRAS, Health Unity, and Community Health Agents, compared to residents of Alterosas. And this wasn't random. It was the result of the real presence. Citrolândia was the territory that resolved the most education actions and intersectoral activities. What made all this work wasn't the number of the posters of lectures, it was the bond. Bonds don't appear by chance. They grow when care comes from someone people already trust, someone who's already present in the other parts of the family's life, like the health agent who brings an exam and also talk about sterilization, or the CRAS work who helps with a benefit and also explain how to get a vet appointment. That's why intersectionality is not just a technical idea. It's what makes animal protection become a natural part of people's life. Before I finish, I needed to say, this didn't start with a perfect plan, and we didn't have guaranteed funding. It started like this. Look at the data, listen to those on the front, understand who we were reaching, and more importantly, who we were not. We didn't wait. It wasn't about emails or reports. It was about having our feet on the ground. We sought at health unities, visited CRAS center, small business, and talked to the people who live and care for the community. And if you learned one thing, it was think. It's not about convincing. It's about building together. And even more. If you're going to start when you hurt the most or more vulnerable, where the risk is greatest, where the pain is visible or simple. Start wherever you can, but start. What I've shared here today is not a magic solution, it's a possible path. And if you are still wondering, it's really possible to do all this with a small team, with little money, we have your answer. With a small team and just over $100 materials, security with the help of partners donation, we carry out 190 events in the last year. In just 2 years, we reached over 20,000 people. We worked in all 10 districts of Betim, and 60% of those meetings happening inside CRAS centers. We stood side by side with the health network, social assistance, emergency management services, schools, environment agents, and NGOs. With little, we did a lot because we did it together. And what I want to leave with you today is very simple. We don't need to start from zero. The territory already has its people, its service, its network. We just need to activate them. If it worked in Beijing, we believe it can work anywhere there's real will to care. Because this is not just a policy for managing dog and cat population. It's a city policy, it's a care policy, it's urban development for people, for animals, and for the territories. We deeply thank all our partners for their support and trust. And we thank SEPA for the opportunity to build this work and share it with the world. Thanks so much.